Good morning, everyone. Today I am going to discuss about research critique for quantitative study. Before going to the topic, I want to say the difference between the criticism and critique. Criticism means it is our self-appointed. Voluntarily, they will come and criticize you. But the critique means critique is invited for helping purpose. Criticism find fault, but whereas critic looks for ways to improve. In what all the way we can improve, that critic will give suggestion. Criticism will condemn. Critic encourages. Criticism is an accuser, a finding fault, but a critic is an ally in helping. Criticism is designed to bring you down, but whereas critic is designed to build you up. Criticism is opinionated, critic is collaborative. Criticism complains, whereas critic consider. Criticism can be hurtful, critic can be helpful. Criticism magnifies the negative, whereas critic magnifies the positive. Critic, commonly we say critic means a person who expresses an unfavorable opinion of something, whereas critic means a detailed analysis and assessment of something. What is a research critic? It is a critical evaluation and appraisal of the research report. It involves a careful examination of all aspects of the study to judge the merits, positive and negatives of the study, meaning and significance and knowledge of the topic. A research critic is an objective evaluation of the research study. Objective evaluation means what? Without any bias. Based on the criteria, we will evaluate the study without any bias. It is written by a research critic to help the researcher to improve their work. Whoever is doing critic, that person will give written report so that it will help the researcher to improve their work. Next definition is critical estimate of a piece of research which has been carefully and systematically studied by a critic who has used specific criteria to appraise the favorable, less favorable, and other general features of the research study. So it is a with carefully and systematically they will read the research report, and each they will cluster the components. So many components are, they will divide the research into the part, and they will appraise what is the positive and negative, what is the positive and negative of the study. All the things they will recognize. Next we will see the purpose of the research critic. The general purpose of the research critic is enable the researcher or help the researcher to refine and improve his research endeavors. Whatever they want to do in the future, it will be helpful for them to improve themselves in the research aspect. Then to assess the students' methodological and analytical skills. Methodological skills, analytical skills, everything we can analyze by using the research critic. Then to identify the limitations and strength. Then seasoned researcher to help the journal editions. Journal editions means what? That so many authors will send the articles to the journal. So as a researcher, we can we can edit the journal articles. For that, research critic will be useful. Then written critic is a guide to researcher. Definitely written critic is there, means they will read where they are lacking, where they are having positive point, everything they will come to know, so that they will improve their research process while doing the research process. Then next purpose is to advance the nursing knowledge and profession. Even for our professional knowledge will increase and nursing knowledge will be added. Then another function, enhancing the researcher's knowledge and competencies. So research critic will help the researcher to enhance the knowledge and the competencies in the research. Then another function, it will act as a facilitator in the ongoing professional development of the researcher who is keenly interested in becoming a research scholar or practitioner. They may be the research scholar or they may be the one is be objective, another one is be constructive. Be objective means what? Without any bias, the researcher can critique, read all the research report, entire report, and give the suggestion. The be constructive means critic should be on advisory. It should not be the destructive manner. It should be in the constructive manner. Okay. Next, critic skills. What are all the critic skills we needed means critical thinking. What are all the critical thinking? It is the intellectual process of contextualizing, applying, analyzing, synthesizing, and by observation, experience, reflection, so that we have to critically read the articles and think and analyze. Logical reasoning means what? There will be in the research process, there is a logical sequence, step by step will be there. Each step will be connected between 1 and 2, so that logical reasoning should be there. Then knowledge of research methodology, that researcher should have a knowledge of research methodology. That means what? In-depth knowledge. Researcher should have a in-depth knowledge about the research methodology, all the steps in the research process. Then attention to detail. That means the researcher should read the article starting from the introduction to till the bibliography, so that he can give the positive and negative very in an effective manner. Then recognition of strength and weaknesses. He should be the capable person to recognize the weakness of the research report and the strength of the researcher's report. Then critic. Next one is critic process. Critic process is the comprehension, comparison, analysis, evaluation, conceptual clustering. Comprehension means what? Able to get the meaning of the material, meaning of the research report. So that the researcher should read the entire article, then only he will comprehend. Comprehend means what? He will identify the meaning of the particular research topic. Then comparison. Comparison, what he will do, the research critic will do the compare the research which he is doing critiquing with the ideal research article. Then analysis. Analysis means what? Systematically and carefully he will do the analysis of the research report and evaluate the research report, whether it is whether the researcher has done the research effectively or not effectively, in which aspect he is positive, in which aspect he is negative, all the things he will evaluate. Then conceptual clustering. Concept, on the basis of concept, the entire research can be clustered into so many aspects, and so that the evaluation will be easy based on the criteria. Next thing is general guidelines. General guidelines, first for doing the critic, researcher or the critic should read the entire article. Then only he can do the critic. Be objective and realistic. So be objective means what? Without any bias, based on the criteria only, he should say the positive and the negatives of the research report. And next one is comment on strength and weaknesses. Strength and weaknesses, first he has to give positive comment also, negative comment also, but give example. If you are giving positive also, negative also, give specific example. Use the positive terms whenever possible. Point first always. Then avoid vague generalization of praise or finding fault. Wherever we are praising the research report or wherever we are finding fault on the research report, avoid vague generalization. Be sensitive in handling the negative comments. When giving positive comments, no problem, but while giving negative comments, we should be very careful. Then suggest the alternative. If you are giving the negative comment, you have to suggest some alternatives also. Next, we will see the elements of the research critic. There are 5 elements are there. One is substantive and theoretical dimension. Next, methodological dimension, ethical dimension, interpretative dimension, presentation and stylistic dimension. First dimension is substantive and theoretical dimension. Readers of the research report, they need to critique the introduction part, that is substantive and theoretical dimension. First, they will, the critic, the person who is doing the critique of the research article will see the whether the study has written, study has contributing to the, or discussing about the significance of the problem, or the concept is elaborately explained or not in the research report. The conceptual framework is the what theory the researcher selected, whether it is appropriate for the particular study or not. So this substantive and theoretical dimension is mainly meant for the introduction chapter, critiquing for the introduction chapter. Next chapter is, next dimension is methodological dimension. Methodological dimension is very important for the research critic. We can say it is the heart of the research critic. It lies in the analysis of the methodological decisions. So four major decision point the critic, the person who is doing critic can follow. What all the decision he has to follow means, first decision, design. So what research design will yield the most clear and meaningful result about the relationship between the independent and dependent variable. So what research design can be followed. So whether the research design is appropriate for the research problem or not, that we have to check. The second decision is, next slide. Second decision is sample. Who should participate in the study as a sample? The decision third is data collection. What method should be used to collect the data? Like we all know the data collection methods like interview, observational checklist, then rating scales, so many methods in a questionnaire, standardized questionnaire, and semi-structured questionnaire, structured questionnaire, like and all we heard, no? So whether we are, what method we are using to collect the data for, to collect the proper data. Then decision for data analysis. So what statistical analysis will provide the most appropriate test of the research hypothesis. So which statistical formula or statistical test will be appropriate for the research problem that the research critic should analyze. Next, this is this methodological aspect of the thing. Next one is ethical dimension. In the ethical dimensions, the researcher should see, the research critic should see whether the right of the human subjects were violated during the investigation, whether informed consent, whether the researcher got informed consent from the participants or not. Any of the ethical principles are violated during the process of the research or not. So the ethical dimensions, the research critic will see the risk benefit ratio. Risk is more means they have to withdraw the study. Benefit is more means they can continue the study. In that way they can do that. Then interpretative dimension. Interpretative dimension means this chapter will do critique over the discussion, conclusion and implication section. So especially why we are doing this chapter critique mean to make sense of the analysis, to consider whether the findings, what the researcher got findings, whether it is supporting the hypothesis or failed to support the hypothesis or theory, that we will check. So this is interpretative dimension. Next dimension is presentation and stylistic dimension. So the critic should check whether the researcher have written the report in a clear manner, grammatically correct, and concise and well organized. The research report should be clear, grammatically correct, concise, and well organized. Then unnecessary terminology should be minimized. That jargon, like we will say, terminology, ununderstandable words should be minimized in that. So these are all the 5 dimensions we have to see while doing critique in the research. Next slide is initial critique. While doing the critique of the research report, first introduction chapter, what are all the things we have to check? What type of study was conducted? We all know quantitative study, qualitative study. Quantitative, so many and experimental study, quasi-experimental study, non-experimental study, pre-experimental study and all is there. So that what type of study was conducted, whether it is apt for the particular research problem, that we have to check. Then next, what was the setting? Where it may be in the hospital, or it may be in the community setup, or it may be in the village, or it may be in the home setup. So which was the setting that we have to analyze, whether the setting was apt for the particular research. To get the data collection, it is okay or not, we have to check. Then next one is where the steps clearly identified. Steps means in the research process, all the 5 phases are there, no? So all the 5 phases, all the steps are there. Maybe around 18 steps are there. All the steps clearly identified or not. Then was there a logical flow? So introduction chapter. After that, review of literature, then only methodology chapter, then only research results, afterwards discussion chapter, then conclusion and summary. So many things will be there. So logically, there is a flow is there or not, that we can check. Then other thing, what are all the things in the initial critique? Next slide. So is the purpose of the study presented or not? Purpose means what? While writing the research report, we used to state our objectives, no? That is the purpose of the study. Whether it is correctly stated all the objectives, specific objectives or not. Then is the significance of the problem discussed. Significance means importance of the problem discussed or not. Then does the investigator provide a sense of what he or she is doing or why? That means what? What is the background of the study? Then why? What is the need for the study? Why? Everything the researcher has to give explanation under the background of the study and the need for the study. So whether it is there or not, that we have to check. So these are all the things in the introduction chapter. We have to do critique. Next, logical consistency. Next slide. Logical consistency means what? The researcher should follow, while writing the research report, the researcher should follow the steps in the process in a logical sequence. Okay, a clear link between the steps. Example, introduction chapter, then followed by introduction chapter, objectives of the study, hypothesis of the study will be there. Then literature review, theoretical framework, research question, methodology section, data analysis, then findings will be there. Afterwards, discussion, then finally conclusion and summary will be there. So whether the researcher while writing the research report followed all the logical consistency is there or not, that we can check. Next one is problem statement. We will move on to the problem statement. Problem statement means you all know that is the statement of the problem, otherwise problem statement, like we will say. So it may be in the declarative form, or it may be in the interrogative form. Interrogative form means what? A question format, it will be there. Declarative format means a declaration will be there in the statement. One is in the questionnaire format, another one is in the side, it is there, no? A study to evaluate the effectiveness of plan teaching program on knowledge regarding anemia among adolescent girls in a selected particular place. Okay, so in that is the problem statement. So the problem statement clear or not? So in one problem statement means it should variables we should see inside the statement. Then whether even sometime we will come to know whether it is experimental study or non-experimental study, that and all it will give clue, and the setting will be there, then population and sample will be there. So these are all the things should be consistent. So if one is missing, that is incomplete problem statement. So whether the researcher has formulated the statement of the problem clear or not, does the investigator identify the key research question and variables to be examined. In this, if you see this statement of the problem, effectiveness of structure teaching program, other plan teaching program is the independent variable. The knowledge regarding anemia is the dependent variable. So it is giving clue for the researcher, those who are doing research critic. Then does the study have the potential to help or solve a problem that is currently faced in the clinical practice? Whatever the problem statement selected by the researcher, whether it is related to the current issue in the professional issues. Example, Corona period, we used to do the research. Everyone did study related to that PPE kit, how to protect ourselves, how to protect others, all the things. So it should be relevant to the profession. So these are all the things we should be clear. Next slide, please. A review of literature. Review of literature. Does the report tie the problem to various related research? That means in what way it is connected with the already published research. What way it is connected, what is known aspect of the research, what is unknown aspect of the research, that and all we will come to know. Then recent literature included or not, because some researcher will write very they will look for the very old research that is not acceptable. That last 5 years research literature should be included. That it is added or not, we have to check as a research critic. Then is the review comprehensive? Comprehensive means what? By reading the review of literature, we will come to know the meaning of the research problem. Then are all cited references relevant to the problem under investigation? If you are doing the knowledge regarding anemia, that all the cited references should be relevant to the knowledge regarding anemia only. Otherwise, anemia related research review of literature only should be stated by the researcher, written in the review of literature. Then is the relationship of the study to previous research. What way it is related with the previous research? It should be clarity should be given by the researcher. Then does the investigator describe the gap in the literature and support the necessity of the present study? Next, theoretical and conceptual framework. We all know theoretical and conceptual framework means we will take one theory, we will adapt some theory. It may be nursing theory or social theory or psychological theory. That theory may be relevant to our research problem. So that theory will have some interrelated concept. We have to connect by using arrow mark. That is theoretical or a conceptual framework. So whether the researcher have selected the appropriate theory or not, that we have to check. Is a rational stated for the theoretical or conceptual framework? Example, if I am doing the any intervention study, I can go for goal attainment theory. King's goal attainment theory. If I do any research related preventive aspect, I can go for Betty Newman's theory, preventive, primary prevention, secondary prevention, and tertiary prevention, like preventive aspect of theory. Suppose behavior modification theory, study related to any behavior modification means I can apply the Johnson behavioral approach theory or any kind of theory. So it should be relevant to the research problem. Whatever theory we are adapting for the particular research problem, that should be relevant or appropriate to the research problem. Does the investigator clearly state the theoretical basis for hypothesis formulation? Hypothesis means you all know tentative prediction, about the relationship between the two or more variables in our particular study. So does it link the problem to the theoretical or conceptual framework in a natural way, whether it is directly applied to this, if you see this picture, individual characteristics, this is a health promotion model is there, individual characteristics and experiences, behavior specific cognitions and effect, behavioral outcome, because that statement of the problem selected by researcher is study to assess the effectiveness of plant teaching program on knowledge regarding anemia among adolescents. So behavior modification, so health promotion model. If because adolescent group are vulnerable to get anemia, that's why this health promotion model will be applicable to the particular research problem. So whatever the research topic we are selecting, we have to select the appropriate relevant conceptual framework. Then next, hypothesis. Next slide. Hypothesis. Is the hypothesis stated clearly? Already I told, no, hypothesis, we all know that tentative prediction, the statement of tentative prediction between the relationship between the two or more variables. So what we have to check while stating the hypothesis, whether the researcher stated the hypothesis clearly, logically, in a form that permit it to be tested. Does it express a predictable relationship? Do they include a general population of interest? Example, I told, no, a study to assess the effectiveness of plant teaching program. So what hypothesis we can state? The researcher can state there will be a significant difference between pre-test and post-test knowledge of the students regarding the anemia, knowledge about anemia. That is first hypothesis. Second objective hypothesis is there will be the significant association between their pre-test knowledge with their socio-demographic variable. So it is logically pre-test, there will be the significant difference between pre-test and post-test. Then there will be the significant association between pre-test knowledge with their socio-demographic variables. Like that, it should be logically, it should be stated, clearly it should be stated. So the critic should check whether the researcher has stated clearly, logically arranged or not, predictable. If the stated hypothesis express a predictable relationship or not, general population of interest is there or not, everything. If you see the side, elderly patients who are prized by nursing personnel for self-feeding require less assistance in feeding than patients who are not prized. That means what? One group of patients, they reinforced, another group of patients not reinforced. So those who are undergo reinforced, they will feed nicely. The other persons not feed. Then one more study statement of the problem, we can state pediatric patients who are given a reward, just giving balloon or permission to watch television. That is the reward. When they cooperate during the nursing procedure, example, injection procedure, tend to be more obliging during those procedures than non-rewarded peers. So hypothesis, whether stated clearly, logically stated, it is expressing a predictable relationship or not. These are all the things we have to check in the hypothesis. Next, operational definitions. So are all of the terms, theories, concept mentioned in the study defined or not? Whether that are defined operationally, which is different from dictionary definition. Operational definition means what? It should not be, we should not write the researcher should not copy the dictionary definition. According to his research problem, according to his circumstances, in his own context, he has to define the terms or concept or variables used in the study. Example, a study to assess the effectiveness of plant teaching program on knowledge regarding anemia among adolescent girls. Okay, in that, what are the term we have to define? Assess, then effectiveness, then what is anemia? What is what is that, adolescent girls, everything we have to define in our own terminology. That is called a operational definition. So all the terms, all the theory, concept, all the variables in the research problem statement is defined by the researcher or not. Suppose if it is defined, whether correctly he defined or not, otherwise simply he copied from the dictionary written or not. If it is copied from dictionary, that is not good. So we can give suggestion as a critic. Next one is methodology. Methodology chapter. Methodology chapter is the first we have to check the design. Whether the researcher selected design selected by the researcher is appropriate for the research question or hypothesis. Is experimental or non-experimental approaches best for the finding the answer for the research question. Then appropriate procedure and the method of data collection described sufficiently and clearly. So what is the method, whether the researcher have explained the method of data collection, tools of data collection, all the things we have to check. Then next slide. Procedure for preventing the contamination between treatment and control group. If you keep two group, experimental and control group, if you are having the experimental group and control group in the same setting, contamination will occur. That's why we will select different setting for experimental group, different setting for control group. Example, third year GNM students is the population means we will select one college as a control group, one college as a treatment group or experimental group. So that we have to check whether the researcher have followed the any procedure for preventing the contamination or not. If there was more than one data collector, was the inter-rater reliability adequate? We know that test, retest, inter-rater, then split half technique and all. But two investigator or more investigators, that means a data collector, not investigator. Investigator may be one, but a data collector may be so many persons. So if they are assigning one more data collector, inter-rater reliability should be adequate. 0.9, 0.7 to 0.9, it should be there. Reliability should be adequate. Then so next one is sample. Are the subjects and sampling methods described? Sample means what? That they should be the subunit of the population. Sampling method means what? Technique of sampling. So many probability sampling, non-probability sampling and all we study, no? That only. So whether the sampling method is appropriate for the particular research problem to get the answer whether the sample are representative or not, the sample's size justified or not by the researcher. It is small also not good. It is the sample size is more also not good. So appropriate sample size, how the researcher calculate the sample size, whether they used power analysis or not, is the sample of sufficient size for the study, given the number of variables and design. So that and all we have to check. Then as a researcher, research critic person, response rate reported by the researcher or not, we have to check. Then are the subjects representative of the sample or not? Are key characteristics described or not? Key characteristics means what? Example, we want to do the research on third year GNM students. So third year GNM students age group may be 20 to 25 only, not 30, or one person is studied some other course and is sitting in the classroom. They may not be the real characteristics because homogeneity will not maintain the, though we are having the sample group of sample, they should have they should maintain the homogeneity. That means what? Same kind of age, same group of age. Then adequacy, sample size should be adequate. They should represent the entire population. Third year GNM students in VPMM college means the third year, it should be generalized to third year GNM students around the world. So that is called a representativeness. Then lack of bias. Lack of bias means what? Without any bias. That's why we have to use the randomized design, randomization. We have to lottery method, or so many random table. By using the random table, flip a coin, so many methods we will use. That the samples are not selected by chance. We are giving equal chance to all the participants, not by choice. Okay, that is called a randomization. So that we can use randomization for minimizing the bias. Next one is ethical consideration. So ethical consideration, so many ethical principles we have to follow, like beneficence. That means that whatever the research intervention we are using, that should be benefited to the participants. Non-maleficence, that means it should not avoid, it should not harm to the participants. Then honesty, loyalty, that justice should be there. Justice means what? They have to freely, they have to voluntarily or freely, they have to decide whether to participate in the study, not to participate in the study. We should not force any participants. So these are all the questions we have to ask, where the participants fully informed about the nature of the research or not. Was the autonomy and previous slide. Previous slide. Was the autonomy and confidentiality of the participants guaranteed or not? Autonomy means what? They freely, they have to voluntarily, they have to come for the study. Confidentiality means what? Whatever the research data we are collecting, that should be confidential. Where the participants protected from harm? Was ethical permission granted from ethical committee or institutional review board for the study? Our institution will have ethical committee or institutional review board, so that the researchers have to get ethical clearance certificate from the committee, then only they can go for the study. Even before starting the study, they have to get ethical clearance from the study. Next, instruments. Instruments means what? The tools for data collection. So tools means what we will say, that is the tool we are using to collect the data, whether the instruments clearly identified and described. It may be the questionnaire, structured questionnaire or semi-structured questionnaire or unstructured questionnaire or observational rating scale or attitude scale or anything it may be. So whether it is appropriate or not, method of development of the tool appropriate with regard to structure, how they developed the tool, whether we used, sometime we can prepare the tool, otherwise we can use the standardized tool already present. If standardized tool is there, means we no need of going for content validity. But suppose we are modifying the standardized tool, or we are creating our own tool, means definitely we have to send our tool for the content validity. So whether the researcher got content validity, whether the researcher did pilot study or not, whether the researcher did checked the validity and the reliability or not, what was the reliability test they used. Example questionnaire we used means a split half technique we can use. Half add question, even question, like add question and even question, like we can divide. Otherwise, first 15 question, next 15 question, like we can divide. That is split half reliability method. Then inter-rater method means two members checking. Then with that we can check the reliability. Then another thing is test retest method, we can check the reliability. So whether adequate reliability is there or not. Above 0.7 it's normal. So whether the researcher got how much reliability, that we have to check whether it is adequate for the getting the answer or not. If instrument new or adapted, means is sufficient testing done or not. So sufficient testing means what? Before going into the main study, we should do the pilot study. We have to check the practicability, feasibility, all the things. Reliability and validity of the instruments adequate or appropriate instruments for data collection used. So all the things, whether whatever the method we are checking knowledge, example for checking the knowledge, we will use the questionnaire. For checking the attitude, what we will use? Rating scales only we will use, or attitude scales only we will use. So observational checklist we will use to check the attitude or skill. For checking the skill, attitude, observational checklist we will use. Next one is After the instruments, data analysis and results. Whether the critic person should check whether the researcher have selected the inferential statistics and descriptive statistics, whether it is appropriate to the getting the answer for the research question, the level of measurement, what level of measurement the researcher described, what descriptive and inferential statistics. Descriptive, it means percentage, mean, median, mode, standard deviation and all in the descriptive statistics. Inferential statistics, parametric and non-parametric, like paired t-test, independent t-test, ANOVA test, MANOVA test, all other thing, chi-square test for association, comparison paired t-test within that thing. Then between the test, experimental and control group means for comparison, we will use independent t-test or student test we will use. So that we have to check whether the researcher selected the appropriate research technique or not, research formula or not, where those descriptive or inferential statistics appropriate to the level of measurement or not, or the inferential statistics used appropriate to the intent of hypothesis. Then does the author report the level of significance set for the study? Example, in nursing studies, we used to keep the level of significance 0.5. Sometimes 0.001 means highly significant. 0.01 means more significant. Just it is significant at the level of 0.05 means it is acceptable at the level of for the nursing studies. So if suppose if they prepared in the results chapter, tables will be there, figures will be there, whether the tables and the figures arranged neatly in the logical manner, that table and the figure should supplement and economize the text. Instead of text only, we are putting the table and the figure. Instead of writing so much paragraph, by seeing the single figure and the single table, the audience will understand the whole picture of the material. So they have precise title and headings also. Footnotes should be there. They should not repeat the text. So in this way, whether the researcher arranged the table and the figure or not. Next slide. Are the results for each hypothesis clearly and objectively presented? Example, the study to assess the effectiveness of plant teaching program on knowledge regarding anemia. In that study, how we have to first pre-test results, afterwards post-test results, then comparison results, and then only we can write the association results, pre-test association, post-test association, everything we have to sequentially and logically we have to arrange the table and the figures. Are the figures and the tables used efficiently to highlight the streamline the presentation of results? Whether the researcher efficiently presented the table or the figures to highlight the results or to streamline the results, that we have to check as a research critic. Then our results described in the light of the theoretical framework are supporting literature. So research results, first objective is assess the existing knowledge of adolescent girls. So pre-test results. Second objective is to check the post-test, to assess the post-test knowledge. So post-test results. So in that way, sequentially and logically, we have to arrange the results in the table and the table, figure, then explanation, everything should be arranged. Next. Discussion chapter. Always we will discuss the research results on the basis of objectives, on the basis of hypothesis, whether the hypothesis accepted or the hypothesis rejected. Research hypothesis accepted or research hypothesis rejected, that we will discuss in the discussion chapter. So all important results discussed or not, we will check. Then interpretation organized in the meaningful fashion or not. Example, in the discussion chapter also, pre-test results first we have to explain, then post-test results, then what is the comparison, how much difference is there between the pre-test and post-test. So how much the total benefit, that means how much percentage gain is there, that we have to check. So logically meaningful fashion we have to interpret our results. Does the interpretation distinguish practical and statistical significance? So at which maybe some research results may be significant at the level of 0.001 level. Some more, it may be highly significant. Post-test comparison may be 0.001 level, but association some point may be significant at a 0.05 level or 0.01 level or 0.001 level. So highly significant, more significant, or just significant. So we have to check at what level it is significant. Whether the researcher has mentioned all the level of significance or not. Then what are all the major findings? Major findings means what? Final findings. That means what is the effectiveness of the study? Whether pre-test knowledge 45%, post-test knowledge 75%. So 75 minus 45%, how much knowledge? In what that component also anemia, knowledge of anemia, different component will be there. Introduction chapter, then pathophysiology chapter, and so which component they post-test they improved, which aspect or which component of anemic knowledge regarding anemia not improved in the post-test also. So that is the major findings. So whether they had any significant association, whether the age had significant association with the knowledge of students, adolescent student, otherwise the parental education may be significant association. Otherwise, a source of information, previously they attended conferences, that may be having significant association between the knowledge of the student and their socio background. So these are all the things we have to discuss in the discussion chapter, whether the researcher have discussed on the basis of the discussed the research results on the basis of hypothesis, on the basis of the what is that, a conceptual framework, on the basis of objective hypothesis. All the things we have to check. Next one is conclusion. Conclusion, if hypothesis testing was done, where the hypothesis supported or not supported, hypothesis really accepted or not accepted, are the results interpreted in the context of the problem, purpose, or hypothesis? Always we are discussing the results on the basis of hypothesis, on the basis of theoretical framework, on the basis of review of literature. So with the review of literature, supported or not supported, then what generalizations are made? Then what relevance for nursing practice does the investigator identify? In what basis it is relevant for our nursing profession? So where we can utilize are the generalization within the scope of the finding or beyond the scope of the finding, our generalization. Example, one college only we will do the research. Example, third year GNM students' knowledge regarding anemia. Okay. So whether we can generalize the findings for whole population. Population means GNM, third year GNM students around the world. So that we have to check. Next one is, next slide. Implications. Implications means what? Impact on our study for the future impact. Future. Future, what impact will be there on the nursing education, on the nursing practice, nursing research, nursing administration, in this heading. Always we used to write the implication in 4 headings: nursing education, nursing practice, nursing administration, nursing research. So example, if I do the massage therapy on labor pain, that study means, if I found in my research massage therapy is effective for labor pain, so I can advise for the nursing practice. The labor room staff nurses can give massage therapy for the laboring women. All the things in that same way. Educational massage therapy regarding the massage therapy, that can be included in the non-pharmacological management, can be included in the nursing curriculum. Nursing research, it can be, the researchers can do what known aspect, what I did, what the future research can do, everything we can give suggestion. Then next, does it include a nursing implication? Whether the researcher include nursing implication or not. If it is included, what implication he put under the heading of all 4 heading, or recommendation for future further research is stated or not. Recommendation means what? Further research we will recommend the researcher. So whether he recommended any further research or not. Next slide. Under the recommendations. Okay, conclusion. Conclusion based on the research research results and related to the hypothesis, related to the objectives, related to the conceptual framework. So conclusion also based on the research results only. Vague research, vague conclusion we should not give. It should be based on the purely based on the research results only. The researcher has to write the conclusion. Are study limitations identified or not? Limitation. Everyone should know the meaning of difference between limitation and delimitation. Delimitation means boundaries. Only VPMM college students, only third year GNM students, only 1 week of data collection. We will make a boundary before starting the research. That is called a delimitation. Limitation means, or study limitation identified means, limitation means while carrying out the study, while really doing the study, whether the researcher felt any difficulties, maybe in the sample selection or in the sampling method or in the data collection, and maybe some dropout will be there during the process. Research, the participants will leave without telling, then they will not follow up, we cannot do. So these are all the limitations. So where the researcher find difficulty, that he has to explain or describe in the limitation, that he explained or not, limitation he mentioned or not, that we have to check. Or generalization made within the scope of the finding. So purely based on the research findings only, we have to make, the researcher have to make generalization, whether he did generalization based on the research results or not, that we have to check. Next one is recommendation. Implication already explained. Recommendation and utilization for nursing practice. Recommendation for the future research, whether he stated recommendation or not. Are there any other studies with similar findings? We have to check in the final chapter also. That what risk benefit are involved for patients if the research findings would be used in the practice. Suppose in future, if our research results, if they utilize it in the clinical practice, what all the risk benefit will happen? Risk is more or benefit is more, that the researcher have to give explanation. Is direct application of the research findings feasible in terms of time, effort, money, and legal or ethical risk? So the researcher have to check whether it is feasible to apply in practice, directly apply in the practice in term of time, effort, money. Simply some treatment will be very effective, but it may be very expensive. So we cannot apply in the practice. So time consuming, some intervention may be time consuming. Some intervention need effort, manpower, material, everything. Some will need risk. So we have to analyze all the things, then only we can utilize utilize the intervention in the nursing intervention, evidence-based practice. So how, under what circumstances are the findings applicable to nursing practice? So which context we can utilize this in the nursing practice, that the researcher has to state in the recommendation. Then should these results be applied to nursing practice? Where we can apply? Would it be possible to replicate the study in another clinical setting? The same study can be recommended in another clinical setting. So these are all the things also we have to check. Next one is references. researcher while reading the research report, we have to check the references. While checking the reference, we have to check the style of reference, whether they followed whatever the format. That means APA style, Vancouver style, what style they followed, the researcher followed, whether it is acceptable format for the particular institution, that we have to check. Then in the reference, additionally, we have to check where all the books, whatever the journals they referred, whatever any other media, any electronic databases they referred, whether they have properly cited in the references or not. That we have to check each and every paragraph where they referred. Everything number should be there and the superscript number should be there. And according to the superscript number, references should be there. Maybe in the APA style or in the Vancouver style or in the different format. So many style of writing references are there, no? That one. Where a standardized system of writing report is followed during writing the bibliography. So standardized system of writing means what? APA style in the institution is following, or in the particular university is following. APA style means APA style only they should follow. They should not follow the Vancouver style. The particular university Vancouver style following, the researcher also should follow the Vancouver style. So standardized system of writing the research report is followed or not, that we have to check. So these are all the things. Anyway, I will summarize in the next slide. Key points. So research critic is very, very important thing. It is a many qualified and student nurses have difficulty understanding the concept or the terminology associated with research and research critic. Student nurses, they are the beginners of the research. Otherwise, so that they will not understand some terminology in the research. So they should understand before going to the going to do the study. If they don't understand anything, they have to understand and they have to start the research process. If they want to apply particular design, means they should have thorough knowledge about the particular research design. So methodology chapter, they should be very thorough. The ability to critically read research is essential. As a person who is doing the critiquing the research should have the critical thinking and logical reasoning should be there, so that they can achieve and maintain and the properly, so that they can properly or effectively do the critique. The critique of a piece of research is not the criticism, but is an impersonal review to highlight the strength and the limitation of the study. Not only finding fault, what we are doing, we are highlighting the strength of the study and also limitation of the study. Or limitation means what? Any negative aspect of the study. So it is important that all the nurses have the ability to critically appraise the research, so that in order to identify the what is best practice, so that we can improve evidence-based practice in nursing setting, in the nursing profession. Evidence-based practice means what? Whatever we are finding the results, that we can utilize it in the research. That is evidence-based practice in our nursing profession. So I summarized. Participants, if you have any doubt, you can ask now. So now you may be understanding the principles of critique, purpose of critique, importance of critique, then critique skills, then critique process, then the whole process, what are all the chapter ways, 5 dimension elements of critiquing the research. 5 different dimensions we have to check. Introduction chapter, afterwards methodological chapter, interpretative, then stylistic dimension, then ethical clearance. So on all these 5 dimensions, we have to do the critique of the research report or a research article. It may be a particular person's research report, otherwise research article published. To publish in the journals also, we have to do critic. Any questions?
Students, if you have any questions, you can ask now. Any questions, students? No
Have we all
questions.
got some idea about research critic?
Okay, hope all MSc, those who are doing MSc would have understood about critic in nursing research. Thank you so much, madam, for accepting our invitation and presenting a very good topic for our MSc students and faculties. Thank you so much, madam, for your valuable time you spent with us.
Sorry for the inconvenience happened in the beginning of the session, because in my laptop camera is not working. That's why I opened in mobile. So both at a time I opened, so echo was there, so that I switched off the camera. In mobile I stopped. Sharing also problem, no? So I started in the laptop. Thank you.
No problem.
Once again, I thank you
Technical
for
issues
giving
will
me this opportunity. In future, we will see properly. I will get ready for with a laptop with a camera. I will get ready, and without any inconvenience, we will present.
No problem, madam. Technical issues will be there. We cannot rest. No problem, madam. Thank you so much. And thank you, my dear students and MSc faculties. Hope this webinar will be useful for everyone. Thank you. Thank you so much.
Thank you. Thank you, Mina.
Thank you, madam. Thank you, ma'am.